I've just come from Cabinet, where I'm very pleased to say they've just approved the Health Regulation of Termination of Pregnancy Bill 2018, and that bill will be published in the coming days and will be introduced into the Dáil to commence its legislative passage next week. It is a very significant day. It is a day where we in government are acting not just on the request but the instruction of the Irish people to get on and legislate in relation to making termination safe and legal in our own country. This bill, when published, you will see, is very much in line with the general scheme that was published in advance of the referendum, and I think that's really important. We took a conscious decision as a government, I took a conscious decision as the Health Minister to make sure we put as much information out there as possible so that people could make an informed decision, whether they voted yes or indeed whether they voted no. They voted knowing what legislation I would bring forward if the referendum to repeal the 8th Amendment was passed. I think obviously it's important to recognise that the Oireachtas has a duty to scrutinise any piece of legislation, and I fully respect that duty. But I would argue that this legislation has been scrutinised in great detail, and indeed this issue has been scrutinised and debated in great detail. In fact, for the last 35 years, the issue of the 8th Amendment and making termination legal in this country has been debated and discussed at great length. And I think it is important that the Oireachtas balances its own duty to scrutinise legislation with facing up to the reality that Irish women are still experiencing in this country today. It's 125 days since we held a referendum to repeal the 8th Amendment. During that time, more than 1,100 Irish women have had to travel abroad to access termination. Today, in our airports, about 9 Irish women will still be travelling abroad. And during that time, about 375 Irish women have also had to access the abortion pill online, illegally, and without medical supervision. So despite the fact that the referendum has passed, about 1,500 women have found themselves in crisis in the duration between today and going back to the referendum, and they still can't access this service safely and legally in their own country. So I would say to colleagues in the Oireachtas, the women have already waited too long, and I think there is a duty on all of us who are honoured enough to sit in the Dáil or the Seanad to scrutinise the legislation, absolutely, to ask the questions on the legislation, absolutely, but also to do that in the knowledge that women today are still having to travel. Women today in Ireland are still at risk because of the pill online and the internet, and also that the bill which the Oireachtas will be debating was published through the general scheme in advance of the referendum, so the Irish people have already scrutinised this proposition.
Minister, some of the abortion support charities have expressed concern about the January deadline. If you keep saying you're going to meet it, if someone ends up with a crisis pregnancy in December, she might delay saving the money for a flight or travelling. Are you 100% sure you'll have them delivered at that deadline? And also, you expressed concern before about Catholic hospitals trying to opt out of a publicly funded health service. At the moment, a lot of taxpayers' money goes to crisis pregnancy agencies that don't give information on abortion for religious reasons. Once abortion is a legal health service here, is it appropriate that taxpayer-funded crisis pregnancy agencies should still be able to opt out of giving information on abortion?
I don't believe it is. I believe that crisis pregnancy agencies, regardless of who owns them or who runs them, if they're funded by the taxpayer, should make all of the information available to women. I don't think that's a pretty radical concept to have. We trust women to make their own decisions. We should inform women of their options and let women make their decisions. And certainly any money coming from my department or from the HSE should be for that purpose. It should be for the purpose of letting women know all of their legal options that they can consider when they find themselves in a crisis. Look, in relation to January, I don't apologise for being ambitious in this regard, and I don't think anybody should step back from that timeline. As I've just pointed out, 1,500 Irish women have experienced abortion since we passed the referendum. Since the scenes of relief in Dublin Castle back in May, 1,500 women have had scenes of crisis and devastation visit their home and visit their personal life. So we have to be ambitious in this regard, and there's 3 things we have to do. We have to pass the law. That's my responsibility with the Oireachtas colleagues, and that's what we're moving forward today. We have to make sure there's medication in this country so that abortion can be medically performed, and that's the job of the HPRA, and they've updated the Oireachtas Health Committee, and they're satisfied that they'll be in a position for that medication to be available in Ireland. And the third thing is the medical profession have to step up too. And I say that, by the way, knowing that many of them want to step up. I say that out of respect to the huge leadership shown by some of them during the referendum campaign. Massive leadership. They played a very big role in passing this. But in terms of clinical guidance and making this operable, they obviously have a responsibility as well. I think that's one they won't shirk. I've already arranged next week to meet with all of the stakeholders, with the Well Women Clinics, with the Irish Family Planning Association, with the Irish College of General Practitioners, with the RCPI, with the Institute of Obstetricians and Gynecologists, with the HSE Mother and Infants Programme. So we will work our way through these issues. But, it's not acceptable to me as Health Minister, and it shouldn't be acceptable to women or anybody who care for women, that we can't have this service in place. I believe we can. I believe it's doable. I accept absolutely the words that I heard people at the Oireachtas Committee say, that it'll be challenging, that it's ambitious. Absolutely, but let's step up to the challenge and let's be ambitious.
Have you spoken to the Finance Minister or for your other kind of colleagues today about providing funding in the budget for the various issues that
Yes.
raised by committee, like ultrasound, MRI? Would that be?
Yeah, no, I have, and I'm glad you raised that, because obviously there's a cost with all of this, and those costs will be determined both through the estimates process and through the discussions that I'll have in terms of the contractual obligations. But yes, let me be clear, and this is one of the big issues that the medical profession are rightly raising. This needs to be resourced. It needs to be resourced adequately so that we can have a safe, woman-centred provision of this service in our country. That is what we're going to do. We don't just need to resource the provision of termination, we also need to resource the ancillary recommendations as well, and I'm determined that we resource both of them, and I'm very confident that government has a full understanding of that, because at every stage that I've gone to government in advance of the referendum and since the referendum on this issue, I've alerted them to the fact that there is a resourcing requirement to this, and we're going to meet that.
What's your current estimate categorically that from the 1st of January next year, abortion services will be available to Irish women in this country?
What I can say from the 1st of January this coming year, abortion services in this country will be legal. That's my responsibility as Minister for Health, and I can say that it's my absolute expectation that abortion services will be available in line with the grounds of the legislation.
You can't guarantee it.
I think the wording of the question is kind of an interesting one. I expect them to be available. Everyone is working absolutely to make this happen. It's an ambitious and challenging time frame. I expect it to happen. There's most of it, I believe, will happen in the primary care setting, because we know most women in Ireland who, even when they travel abroad in their early pregnancy. We will finalise in the coming weeks how we need to resource general practice to do that. We already know that there's a certain number of abortions that happen in Ireland already every year in relation to a woman's life. That ground will be expanded to cover a serious risk to a woman's health. We know that the women who have fatal fetal abnormalities during their pregnancy are already known to the health service. They're already women in our maternity hospitals. They're not new women or extra women coming into our country. They are women that we have a duty to care for, that up until this point we're caring for them to a point, and then we're saying, but you've to leave and go abroad. So this is not a huge number of new women accessing the Irish Health Service. This is doable, and there's a responsibility on everybody to do it. I won't be found wanting in terms of providing the leadership from my perspective. In fairness to the medical profession, I don't believe they'll be found wanting either.
Minister, can I bring back to resources as well?
Yep.
We're rolling out this legislation, separate legislation for the safe access zones.
Oh yes.
But where are we in terms of that other recommendation from the committee in terms of contraception and better provisions for it? I know we're working group set up. Is there any sort of talks with budget-wise about
Sure.
rolling out those sort of provisions also?
Sure. I'm glad you reminded me about the safe access zones, because I'm very determined we're going to do this. I find it reprehensible that a maternity hospital in this country has to tweet out information telling women accessing their hospital to be kind of careful, or to maybe consider a different route in, because of people engaging in what they consider to be a form of protest, but something that's extraordinarily upsetting, with obscene imagery, and in some ways harassing people working in both the hospital and people accessing the hospital. So I have a duty of care to healthcare professionals, and a duty of care to women and all citizens as they access our health services. I have made the decision, after consulting with the Attorney General and others, that I will bring the safe access zones forward in a separate piece of legislation, because I just think it works better from a legal perspective. So that is my intention. In relation to the ancillary recommendations, yeah, you're quite correct. There's very specific ancillary recommendations in relation to contraception. My intention is to start in 2019 through the budgetary process with a significant increase in the availability of barrier contraception condoms. That obviously has a benefit in terms of reducing crisis pregnancy. It also has a wider health benefit in terms of reducing STIs. So there's a very significant health benefit. In relation to female contraception, I am determined that we address the cost issue there. I have asked officials to work with medical experts there. That work is ongoing. It's likely that work will require an amendment to legislation in due course, because, as you know, a woman today who has a medical card can access contraception free. There's two issues. Obviously the cost of the doctor's visit, because women generally need to see a doctor on these matters, and secondly then the cost of the actual contraception. So it's likely to require an amendment to primary legislation, but I hope we can make progress on that in 2019.
What's your current estimate on the cost of regional service?
It's significant. I don't have a public figure today, because for a number of reasons.
You have to tell your colleagues.
I don't have a public figure today, for a number of
You
reasons.
have a figure, you're just choosing not to tell us.
I'm not making a figure public today, absolutely. When I brief the cabinet, that is meant to be a confidential process. Sometimes that works and sometimes that doesn't, but it's meant to be a confidential process. And the reason is twofold. One, we have an estimates process ongoing at the moment that I'm engaged with Minister Donoghue, and we have a budget in a very short period of days. And secondly, we also have contractual negotiations in terms of the cost with GP representative bodies as well. So this will be a significant cost, so I want to be very clear on this. This is not something that can be in any way shortchanged in terms of the delivery of a safe, woman-centred service that doctors can have confidence in, that women can have confidence in, and that can fulfil the ambition of those who went out and voted yes in the referendum in May. So this will be a cost, and this cost will be of many millions, but the final figure won't be crystallised for another few months.